address this. Maybe they've been with them for a really long time and they're just beginning to wake up. So sort of
empowering. So I think, as a mindset coach, as I thought about this, the first thing that came to
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am so blessed today to be joined by the amazing Nicole Williams. Nicole comes to us from the Kidney Nutritional Institute. So Nicole, thank you firstly for joining us and giving up your time to be here. I really, really appreciate it.
Yes. Thank you so much for that introduction and for the invitation.
So walk me through, when do you know to cut a provider free? What are the things that you look for? And then what is the conversation, or do you not even have a conversation, you just book somewhere else? What is the conversation that you have around that? How would you, someone going, well, I'm not getting my needs met, how do I address this? Maybe they've been with them for a really long time and they're just beginning to wake up to sort of this stuff now. So walk us through that, how that looks and how you would deal with that.
Yeah. I think, so first thinking about the messages that you might be getting from your provider. So at some point, if you're looking to end that relationship, you probably are also, there might be some messages you're getting from them that are not ones that are more empowering. So I think, as a mindset coach, as I thought about this, the first thing that came to mind is that to understand that you are valued, and that if a provider is like you said earlier, the provider said that you would be in a wheelchair. Sometimes they send out these doomsday messages, and so first thing is try not to internalize that as it meaning that you're not valued, is what I'm trying to say there. And so there's a few things I would encourage someone to think about first, and that is thinking or looking at other patient resources that are available for you. So that may look like filing a grievance report, speaking with a manager if there's a point that you really feel uncomfortable. Arming yourself with information. So arming yourself with science-backed information, connecting with other groups, such as K&I, for example, if it's kidney disease, that can provide a more holistic look and holistic approach to your health. Using another trusted provider as an advocate for you. So do you have a PCP that you really trust, or another specialist who you can confide in, share information with, and get their thoughts, or even request that they reach out to the nephrologist or whomever on your behalf to kind of maybe smooth things over or help understand what your mutual goals are. And then finally, I would say, if you're at a point where you do want to sever ties, make sure that it is because you're not getting that value from that provider. And the other part of this, particularly within the US healthcare system, is sometimes someone doesn't always have the means to change provididers. So it could be due to their insurance limitations, or maybe availability of that specialist that they're looking for. So just, recognizing that too, that there are could be other limitations to that. First and foremost, someone's healing and improvement in their health outcomes is really linked to their trust in their provider. And then
yes,
so
many studies are done.
Feeding back that trust and support for them. So again, if you don't feel that's what you're getting, that could also really be a sign that you should look for another specialist.
Yeah, I can't, that point, and I'm so glad that you said that, Nicole, because there are so many studies to show, proper good studies that show that if you trust your healthcare provider, your rate of healing, and I'm going to make up a number, I don't know what it was, but it can contribute up to 80% of the therapeutic relationship, can be up to 80% of the healing. And so it's not a small number. So your point, if you don't feel trust, or that they're a professional, or that they have your best interests at heart, it will absolutely hamper your ability to get well. And right. I can't state that myself enough. That is, we've got the nocebo and the placebo effect. And the nocebo effect is when a professional, like they said to me, is you'll end up in a wheelchair in 5 years. Or the classic ones with cancer is and they did this great study, you've got 3 months to live. And the study showed that a huge percentage of people, almost 3 months to the day, will die because that's what the professional said, because they handed all their power over to that person. And then they went back and tested them, and there was this crazy study where a huge percentage of those people didn't even have cancer, and they died because someone told them they would. So that's nocebo. And then that's how powerful that bond is, that relationship. And then on the other side of that, you've got the placebo. If you've got someone that's advocating for you and sort of being your cheerleader and supporting you, how much that contributes to the healing journey. So you reminded me about that. So I'm really glad that you brought that up. So if you want to know more about what we do, head to www.kidneycoach.com. You can also find us on Facebook.com/Kidney Coach. Make sure you hit subscribe. That means you'll get notified anytime we do new videos. And we will definitely have Nicole back. I've sent her and I have talked about a whole pile of topics, and she's got a wealth of information there that I would love to extract from her to be able to share with the community. So Nicole, thanks again. I really appreciate your time, and we look forward to seeing you next time. Thanks for being part of our community. Bye.
Bye.